Hi, everyone. This is Nurse Anna from nursestudy.net, and we are going to be doing 35 questions SATA and case study for fundamentals of nursing. Enjoy. Before I forget, I do have free audiobooks via A6 Audible. All you need to do is look at the link in the description, and it's a free 30-day trial. You can get through the book within the 30 days. So please utilize this to get more questions for NCLEX NGN that you can listen to in your car or in the library.
Question 1. SATA. A client is admitted with a suspected urinary tract infection, UTI, and reports dysuria, frequency, and fever. Which nursing interventions should the nurse prioritize? Select all that apply. A. Obtain a urine sample for culture and sensitivity. B. Administer antibiotics as prescribed. C. Encourage increased fluid intake unless contraindicated. D. Apply warm compresses to the lower abdomen. E. Initiate a Foley catheter for urine collection. Correct answers A, B, C, D. Detailed rationales. A. Obtain a urine sample for culture and sensitivity. Why correct? A urine culture identifies the causative organism and guides antibiotic therapy. How it helps, ensures appropriate and effective treatment for the infection. B. Administer antibiotics as prescribed. Why correct? Antibiotics are the cornerstone of UTI treatment to eradicate the infection. How it helps, addresses the underlying cause of the symptoms, reducing complications. C. Encourage increased fluid intake unless contraindicated. Why correct? Hydration helps flush bacteria from the urinary system and supports recovery. How it helps, reduces symptoms like dysuria and frequency by diluting the urine. D. Apply warm compresses to the lower abdomen. Why correct? Warm compresses can alleviate discomfort associated with bladder spasms. How it helps, provides non-pharmacological pain relief for the client. E. Initiate a Foley catheter for urine collection. Why incorrect? Indwelling catheters increase the risk of catheter-associated UTIs, CAUTIs. What to do instead? Use non-invasive methods like clean catch urine for sample collection. Question 2. Case study, multiple choice. Scenario: a 65-year-old client is admitted with a diagnosis of pneumonia. The client is short of breath, febrile, and has a productive cough, with yellow sputum. Oxygen saturation is 88% on room air. What is the nurse's priority action? A. Administer antibiotics as prescribed. B. Collect a sputum sample for culture. C. Start oxygen therapy at 2 liters per minute by a nasal cannula. D. Encourage the client to increase fluid intake. Correct answer, C. Start oxygen therapy at 2 liters per minute by a nasal cannula. Detailed rationales. A. Administer antibiotics as prescribed. Why incorrect? While antibiotics are critical, ensuring adequate oxygenation is the priority. Risks: delaying oxygen therapy may lead to hypoxemia complications. B. Collect a sputum sample for culture. Why incorrect? This is essential for targeted treatment but not urgent compared to addressing hypoxia. Risks: delaying oxygen therapy can worsen respiratory status. C. Start oxygen therapy at 2 liters per minute by a nasal cannula. Why correct? Oxygen therapy is required to improve oxygen saturation and alleviate hypoxia. How it helps, stabilizes the client's condition and prevents further deterioration. D. Encourage the client to increase fluid intake. Why incorrect? Hydration is important for loosening secretions, but is not the immediate priority. Risks: focusing on fluids first may delay critical interventions for hypoxia. Question 3. SATA. A client is postoperative from abdominal surgery and reports increasing pain at the incision site. The nurse notes redness, swelling, and purulent drainage. Which nursing interventions should the nurse implement? Select all that apply. A. Notify the healthcare provider. B. Obtain a wound culture. C. Reinforce the dressing with clean gauze. D. Administer prescribed analgesics. E. Educate the client on proper hand hygiene. Correct answers A, B, E. Detailed rationales. A. Notify the healthcare provider. Why correct? Signs of infection require prompt medical evaluation for potential intervention. How it helps: prevents progression to systemic infection or sepsis. B. Obtain a wound culture. Why correct? Identifies the causative pathogen to guide appropriate treatment. How it helps: ensures targeted antibiotic therapy. C. Reinforce the dressing with clean gauze. Why incorrect? This action does not address the underlying infection. What to do instead: dressings should be changed with sterile technique and appropriate interventions initiated. D. Administer prescribed analgesics. Why incorrect? Pain relief is important but does not address the root cause, infection. Risks: symptom masking without resolving the infection can lead to worsening of the condition. E. Educate the client on proper hand hygiene. Why correct? Prevents further contamination of the wound. How it helps: reduces the risk of additional infections and supports recovery. Question 4, Case Study, Multiple Choice. Scenario: a client is experiencing diarrhea after receiving a course of broad-spectrum antibiotics. The nurse suspects Clostridioides difficile (C. diff) infection. What is the most appropriate nursing intervention? A. Administer antidiarrheal medication. B. Initiate contact precautions. C. Encourage a high-fiber diet. D. Place the client on NPO status. Question 4. Correct answer, B. Initiate contact precautions. Detailed rationales. A. Administer antidiarrheal medication. Why incorrect? Antidiarrheal agents can worsen toxin retention in C. diff infections. Risks: increases the risk of toxic megacolon. B. Initiate contact precautions. Why correct? C. diff is highly contagious and requires contact isolation to prevent transmission. How it helps: protects other clients and healthcare staff. C. Encourage a high-fiber diet. Why incorrect? Fiber is not appropriate during active diarrhea as it may exacerbate symptoms. Risks: can worsen gastrointestinal irritation. D. Place the client on NPO status. Why incorrect? NPO status is not necessary unless the client is severely dehydrated or at risk of aspiration. What to do instead: maintain hydration and assess fluid balance. Question 5, SATA. A nurse is preparing to administer medications through a nasogastric (NG) tube. Which steps are essential to ensure safe medication administration? Select all that apply. A. Verify tube placement before administering medication. B. Flush the tube with 30 milliliters of water before and after medication administration. C. Crush all medications together to administer as a single dose. D. Check the medication compatibility with enteral administration. E. Keep the client supine during the procedure. Correct answers A, B, D. Detailed rationales. A. Verify tube placement before administering medication. Why correct? Ensures that the NG tube is correctly positioned in the stomach or small intestine. How it helps: prevents aspiration or improper medication delivery. B. Flush the tube with 30 milliliters of water before and after medication administration. Why correct? Prevents clogging of the NG tube and ensures medication reaches the stomach. How it helps: maintains tube patency and proper drug absorption. C. Crush all medications together to administer as a single dose. Why incorrect? Some medications should not be crushed due to extended release properties or incompatibility. What to do instead: prepare medications individually as appropriate. D. Check the medication compatibility with enteral administration. Why correct? Ensures the medication can be safely delivered via NG tube. How it helps: reduces the risk of tube obstruction or drug inefficacy. E. Keep the client supine during the procedure. Why incorrect? Supine positioning increases the risk of aspiration. What to do instead? Keep the client at a 30 to 45 degrees angle during and after administration. Question 6. Case study, multiple choice. Scenario: a 78-year-old client with a history of hypertension and diabetes is admitted for a left-sided stroke. The client presents with right-sided weakness, slurred speech, and difficulty swallowing. What is the nurse's priority intervention? A. Administer prescribed antihypertensive medication. B. Perform a bedside swallow assessment. C. Elevate the head of the bed to 30 degrees. D. Notify the healthcare provider of the client's symptoms. Correct answer: B. Perform a bedside swallow assessment. Detailed rationales. A. Administer prescribed antihypertensive medication. Why incorrect? Although blood pressure management is critical, the immediate concern is the risk of aspiration due to swallowing difficulties. Risks: delaying a swallow assessment can lead to aspiration pneumonia. B. Perform a bedside swallow assessment. Why correct? Stroke clients often have dysphagia, increasing the risk of aspiration. Assessing swallowing ability ensures safe oral intake. How it helps determines the need for further evaluation or alternative feeding methods. C. Elevate the head of the bed to 30 degrees. Why incorrect? Elevating the bed supports airway protection but does not address swallowing safety directly. What to do instead? Combine head-up bed elevation with a swallow assessment. D. Notify the healthcare provider of the client's symptoms. Why incorrect? The symptoms are consistent with the admitting diagnosis of stroke. Focus should be on mitigating immediate risks such as aspiration. What to do instead? Prioritize nursing actions to prevent complications. Question 7. SATA. A client is admitted with a diagnosis of deep vein thrombosis, DVT, in the left leg. Which nursing interventions should the nurse implement? Select all that apply. A. Elevate the affected leg. B. Apply compression stockings to both legs. C. Administer prescribed anticoagulants. D. Encourage early ambulation. E. Monitor for signs of pulmonary embolism. Correct answers: A, C, E. Detailed rationales. A. Elevate the affected leg. Why correct? Elevating the leg promotes venous return and reduces swelling. How it helps: decreases discomfort and edema associated with DVT. B. Apply compression stockings to both legs. Why incorrect? Compression stockings are contraindicated on the affected leg in acute DVT due to the risk of dislodging the clot. What to do instead? Use stockings on the unaffected leg to prevent DVT development. C. Administer prescribed anticoagulants. Why correct? Anticoagulants prevent clot propagation and reduce the risk of pulmonary embolism. How it helps: directly addresses the underlying condition and its complications. D. Encourage early ambulation. Why incorrect? Early ambulation is generally avoided in the acute phase of DVT to prevent clot dislodgement. What to do instead? Reassess mobility once the clot is stabilized. E. Monitor for signs of pulmonary embolism. Why correct? Pulmonary embolism is a severe complication of DVT that requires immediate intervention. How it helps: early detection improves outcomes in case of embolism. Question 8. Case study, multiple choice. Scenario: a client with heart failure presents with dyspnea, crackles in the lungs, and bilateral lower extremity edema. The healthcare provider prescribes furosemide, Lasix, IV. What is the nurse's priority action after administering the medication? A. Monitor the client's potassium level. B. Encourage the client to increase fluid intake. C. Reassess the client's lung sounds and respiratory status. D. Educate the client about furosemide's potential side effects. Correct answer: C. Reassess the client's lung sounds and respiratory status. Detailed rationales. A. Monitor the client's potassium level. Why incorrect? Monitoring potassium is essential, but not the immediate priority post-medication administration. What to do instead: monitor potassium levels during routine assessments. B. Encourage the client to increase fluid intake. Why incorrect? Fluid intake should be carefully managed in heart failure clients to avoid exacerbating symptoms. What to do instead: balance fluid intake with output and clinical status. C. Reassess the client's lung sounds and respiratory status. Why correct? Furosemide reduces fluid overload, improving respiratory symptoms. How it helps: confirms the effectiveness of the medication and guides further interventions. D. Educate the client about furosemide's potential side effects. Why incorrect? Education is important but can be deferred until immediate concerns are addressed. What to do instead: focus on monitoring clinical outcomes post-administration. Question 9, SATA. A client with an indwelling urinary catheter develops a fever and cloudy urine. Which actions should the nurse take? Select all that apply. A. Notify the healthcare provider. B. Remove the catheter immediately. C. Collect a urine sample for culture and sensitivity. D. Increase the client's oral fluid intake. E. Perform catheter care per facility protocol. Correct answers: A, C, D, E. Detailed rationales. A. Notify the healthcare provider. Why correct? Fever and cloudy urine are signs of a urinary tract infection, UTI, that require prompt evaluation. How it helps: ensures timely intervention to prevent complications like sepsis. B. Remove the catheter immediately. Why incorrect? The catheter should not be removed without an order, especially before obtaining a urine sample. What to do instead: follow protocol for urine culture collection and catheter management. C. Collect a urine sample for culture and sensitivity. Why correct? Identifies the causative organism to guide appropriate treatment. How it helps: ensures targeted antibiotic therapy. D. Increase the client's oral fluid intake. Why correct? Promotes hydration, which helps flush bacteria from the urinary system. How it helps: reduces bacterial colonization and supports recovery. E. Perform catheter care per facility protocol. Why correct? Regular catheter care reduces the risk of further infection and complications. How it helps: maintains hygiene and minimizes the spread of bacteria. Question 10, Case Study, Multiple Choice. Scenario: a client recovering from surgery reports increasing shortness of breath and chest pain that worsens with deep breathing. The nurse notes a respiratory rate of 28 breaths per minute and oxygen saturation of 85% on room air. What is the nurse's priority intervention? A. Notify the healthcare provider immediately. B. Administer oxygen via non-rebreather mask. C. Assist the client to a semi-Fowler's position. D. Perform a focused respiratory assessment. Correct answer: B. Administer oxygen via non-rebreather mask. Detailed rationales. A. Notify the healthcare provider immediately. Why incorrect? The healthcare provider must be notified, but the immediate priority is stabilizing oxygenation. What to do instead: address hypoxia first to prevent further deterioration. B. Administer oxygen via non-rebreather mask. Why correct? A non-rebreather mask delivers high concentrations of oxygen, improving hypoxia. How it helps: quickly stabilizes oxygen levels while further assessments are performed. C. Assist the client to a semi-Fowler's position. Why incorrect? Positioning helps ease breathing but does not directly address oxygenation. What to do instead: combine positioning with oxygen therapy. D. Perform a focused respiratory assessment. Why incorrect? Assessment is critical but does not take precedence over immediate intervention for hypoxia. What to do instead: conduct the assessment after oxygenation is stabilized. Question 11, SATA. A client with chronic obstructive pulmonary disease, COPD, presents with worsening dyspnea, a productive cough, and an oxygen saturation of 90% on room air. Which nursing intervention should the nurse prioritize? Select all that apply. A. Administer prescribed bronchodilators. B. Encourage the client to use pursed lip breathing. C. Place the client in a high Fowler's position. D. Start oxygen therapy at 6 liters per minute by a nasal cannula. E. Educate the client to increase their physical activity immediately. Correct answers A, B, C. Detailed rationales. A. Administer prescribed bronchodilators. Why correct? Bronchodilators open airways and improve airflow, relieving dyspnea. How it helps, directly addresses the underlying airway obstruction associated with COPD. B. Encourage the client to use pursed lip breathing. Why correct? Pursed lip breathing slows exhalation, helps reduce air trapping, and improves oxygenation. How it helps, alleviates the sensation of breathlessness. C. Place the client in a high Fowler's position. Why correct? High Fowler's position facilitates lung expansion and eases breathing. How it helps, improves oxygenation and reduces respiratory effort. D. Start oxygen therapy at 6 liters per minute by a nasal cannula. Why incorrect? Clients with COPD should receive oxygen cautiously to prevent suppressing their hypoxic drive. What to do instead? Initiate oxygen therapy as prescribed, typically at a low flow rate, e.g., 1 to 2 liters per minute. E. Educate the client to increase their physical activity immediately. Why incorrect? Physical activity should be tailored to the client's respiratory status and done gradually. Risks: overexertion can exacerbate symptoms. Question 12, case study, multiple choice. Scenario: a 55-year-old client presents with a suspected myocardial infarction, MI. The nurse notes chest pain radiating to the left arm, diaphoresis, and nausea. What is the nurse's priority intervention? A. Obtain a 12-lead ECG. B. Administer sublingual nitroglycerin as prescribed. C. Start an IV line with normal saline. D. Notify the healthcare provider. Correct answer A. Obtain a 12-lead ECG. Detailed rationales. A. Obtain a 12-lead ECG. Why correct? An ECG confirms the diagnosis of an MI and identifies the location and severity of ischemia. How it helps, guides subsequent treatment decisions such as medication or intervention. B. Administer sublingual nitroglycerin as prescribed. Why incorrect? While nitroglycerin is critical for pain relief and vasodilation, confirming the diagnosis is the immediate priority. What to do instead? Administer nitroglycerin after the ECG is obtained. C. Start an IV line with normal saline. Why incorrect? Establishing IV access is essential, but does not take precedence over diagnostic confirmation. What to do instead? Obtain the ECG first, then start the IV line. D. Notify the healthcare provider. Why incorrect? The nurse should gather diagnostic data, ECG, before notifying the provider. What to do instead? Report the ECG findings promptly.
Hi everyone, Nurse Anna here from nursestudy.net, and I want to invite you to join our website. Just look at it, it's all free. Basically, you can just go to the website, type in over here your subject, fever, hyperthermia, here's an example, and it'll give you the basic causes, things to do, and care plans with nursing interventions and rationales. Don't forget to visit nursestudy.net.
Question 13, SATA. A nurse is caring for a postoperative client who is at risk for deep vein thrombosis, DVT. Which interventions should the nurse include in the client's plan of care? Select all that apply. A. Encourage frequent ambulation. B. Administer prescribed anticoagulants. C. Apply sequential compression devices, SCDs. D. Keep the client on strict bed rest. E. Encourage adequate hydration. Correct answers A, B, C, E. Detailed rationales. A. Encourage frequent ambulation. Why correct? Early ambulation promotes venous return and reduces stasis. How it helps: decreases the likelihood of clot formation. B. Administer prescribed anticoagulants. Why correct? Anticoagulants reduce the risk of clot development by inhibiting the coagulation cascade. How it helps: prevents complications such as DVT or pulmonary embolism. C. Apply sequential compression devices, SCDs. Why correct? SCDs improve venous return by mimicking muscle contractions. How it helps: prevents venous stasis and clot formation. D. Keep the client on strict bed rest. Why incorrect? Prolonged immobility increases the risk of DVT. What to do instead: encourage movement and active leg exercises when possible. E. Encourage adequate hydration. Why correct? Hydration prevents hemoconcentration, which reduces the risk of clot formation. How it helps: supports healthy blood flow. Question 14, case study, multiple choice. Scenario: a client with type 2 diabetes is admitted for hypoglycemia after taking insulin and skipping a meal. The client is drowsy but arousable, with a blood glucose level of 52 mg per deciliter. What is the nurse's priority action? A. Administer 15 grams of oral glucose. B. Notify the healthcare provider. C. Start an IV line and administer D50. D. Recheck blood glucose in 15 minutes. Correct answer: A. Administer 15 grams of oral glucose. Detailed rationales. A. Administer 15 grams of oral glucose. Why correct? Providing fast-acting glucose is the first-line treatment for mild to moderate hypoglycemia. How it helps: rapidly increases blood glucose levels, alleviating symptoms. B. Notify the healthcare provider. Why incorrect? Addressing the immediate hypoglycemia is the priority before contacting the provider. What to do instead: notify the provider if symptoms persist after initial intervention. C. Start an IV line and administer D50. Why incorrect? IV glucose is reserved for severe hypoglycemia or when the client is unconscious. What to do instead: use oral glucose first if the client is alert enough to swallow. D. Recheck blood glucose in 15 minutes. Why incorrect? Rechecking is important but only after administering glucose to correct the hypoglycemia. What to do instead: treat first, then reassess. Question 15, SATA. A client reports feeling faint and weak after undergoing a routine blood draw. Which nursing interventions should the nurse implement? Select all that apply. A. Assist the client to a lying position. B. Check the client's vital signs. C. Provide a glass of orange juice. D. Apply a cold compress to the client's forehead. E. Elevate the client's legs. Correct answers: A, B, E. Detailed rationales. A. Assist the client to a lying position. Why correct? Lying down reduces the risk of falling and improves blood flow to vital organs. How it helps: prevents injury and supports recovery. B. Check the client's vital signs. Why correct? Vital signs help assess the client's condition and identify potential complications such as hypotension. How it helps: guides further interventions based on clinical data. C. Provide a glass of orange juice. Why incorrect? Orange juice is not indicated unless the client has hypoglycemia. What to do instead: assess for underlying causes before administering any fluids. D. Apply a cold compress to the client's forehead. Why incorrect? Cold compresses may not address the root cause of the symptoms, e.g., hypotension or vasovagal response. What to do instead: focus on positioning and monitoring vital signs. E. Elevate the client's legs. Why correct? Elevating the legs promotes venous return and improves circulation to the brain. How it helps, alleviates symptoms of faintness and prevents syncope. Question 16, case study, multiple choice. Scenario: a 72-year-old client with a history of hypertension and chronic kidney disease is admitted for fluid overload. The client has bilateral pitting edema, crackles in the lungs, and a blood pressure of 170/90 millimeters of mercury. The healthcare provider prescribes IV furosemide, Lasix. What should the nurse prioritize after administering the medication? A. Monitor urine output. B. Reassess the client's blood pressure. C. Check the client's potassium levels. D. Assess the client's weight. Correct answer: A. Monitor urine output. Detailed rationales. A. Monitor urine output. Why correct? Furosemide promotes diuresis, so monitoring output is essential to assess effectiveness. How it helps: confirms the medication is reducing fluid overload and improving symptoms. B. Reassess the client's blood pressure. Why incorrect? Although important, blood pressure reassessment is secondary to ensuring diuresis is occurring. What to do instead: monitor BP as part of ongoing assessments after confirming diuretic effectiveness. C. Check the client's potassium levels. Why incorrect? Potassium monitoring is crucial, but not an immediate priority after administration. What to do instead: perform routine electrolyte checks during follow-up care. D. Assess the client's weight. Why incorrect? Weight tracking is a long-term measure of fluid status and is not an immediate intervention. What to do instead: focus on urine output as a more immediate indicator of response to diuretics. Question 17, SATA. A nurse is preparing a client for surgery under general anesthesia. Which preoperative nursing interventions should the nurse prioritize? Select all that apply. A. Verify the client's NPO status. B. Ensure the client has signed the consent form. C. Administer prescribed preoperative medications. D. Remove the client's dentures and jewelry. E. Teach postoperative breathing exercises. Correct answers: A, B, C, D. Detailed rationales. A. Verify the client's NPO status. Why correct? NPO status reduces the risk of aspiration during anesthesia. How it helps: ensures client safety during the surgical procedure. B. Ensure the client has signed the consent form. Why correct? Legal and ethical standards require informed consent before surgery. How it helps: confirms that the client understands the procedure and agrees to proceed. C. Administer prescribed preoperative medications. Why correct? Medications like sedatives or antibiotics prepare the client for surgery and reduce risks. How it helps: supports optimal surgical outcomes and prevents complications like infection. D. Remove the client's dentures and jewelry. Why correct? Dentures and jewelry can pose safety risks during surgery. How it helps: prevents airway obstruction and electrical burns from equipment. E. Teach postoperative breathing exercises. Why incorrect? Teaching is important but not a priority immediately before surgery. What to do instead: focus on preoperative preparation tasks and provide education post-surgery. Question 18, case study, multiple choice. Scenario: a client with a history of asthma is admitted with an acute exacerbation. The nurse notes audible wheezing, a respiratory rate of 28 breaths per minute, and difficulty speaking in full sentences. What is the nurse's priority action? A. Administer a prescribed bronchodilator via nebulizer. B. Place the client in a high Fowler's position. C. Initiate oxygen therapy via nasal cannula at 4 liters per minute. D. Notify the healthcare provider immediately. Correct answer: A. Administer a prescribed bronchodilator via nebulizer. Detailed rationales. A. Administer a prescribed bronchodilator via nebulizer. Why correct? Bronchodilators relieve bronchospasm and improve airflow, addressing the immediate cause of respiratory distress. How it helps: rapidly reduces airway obstruction and alleviates symptoms. B. Place the client in a high Fowler's position. Why incorrect? Positioning helps ease breathing but does not directly address bronchospasm. What to do instead: combine positioning with administering the bronchodilator. C. Initiate oxygen therapy via nasal cannula at 4 liters per minute. Why incorrect? Oxygen therapy supports oxygenation but does not resolve the underlying bronchospasm. What to do instead: administer oxygen if needed after addressing the airway obstruction. D. Notify the healthcare provider immediately. Why incorrect? The provider must be informed of the client's status, but immediate intervention to improve breathing is the priority. What to do instead: stabilize the client first, then notify the provider. Question 19, SATA. A client with a central venous catheter, CVC, develops a fever and chills. Which nursing interventions should the nurse prioritize? Select all that apply. A. Notify the healthcare provider. B. Obtain blood cultures from the catheter and a peripheral site. C. Administer prescribed antibiotics. D. Apply a warm compress to the insertion site. E. Monitor the client for signs of sepsis. Correct answers: A, B, C, E. Detailed rationales. A. Notify the healthcare provider. Why correct? Fever and chills are potential signs of a catheter-related bloodstream infection, CRBSI. Prompt reporting ensures timely intervention. How it helps: prevents progression to systemic infection or sepsis. B. Obtain blood cultures from the catheter and a peripheral site. Why correct? Blood cultures identify the source of infection and guide appropriate treatment. How it helps: ensures targeted antibiotic therapy. C. Administer prescribed antibiotics. Why correct? Antibiotics are essential to treat the infection and prevent complications. How it helps: reduces the risk of systemic spread. D. Apply a warm compress to the insertion site. Why incorrect? Warm compresses are not appropriate for suspected CRBSI. What to do instead: focus on systemic infection management. E. Monitor the client for signs of sepsis. Why correct? Fever and chills can indicate sepsis, which requires close monitoring and rapid intervention. How it helps: early detection improves outcomes and guides treatment. Question 20, case study, multiple choice. Scenario: a client is admitted for severe dehydration after experiencing prolonged vomiting and diarrhea. The healthcare provider prescribes IV normal saline at 125 milliliters per hour. The nurse notes a heart rate of 110 beats per minute and a blood pressure of 88/50 millimeters of mercury. What is the nurse's priority action? A. Increase the IV fluid rate as ordered. B. Notify the healthcare provider of the client's status. C. Reassess the client's vital signs in 15 minutes. D. Position the client flat with legs elevated. Correct answer: D. Position the client flat with legs elevated. Detailed rationales. A. Increase the IV fluid rate as ordered. Why incorrect? Adjusting IV fluids requires a provider order, even in urgent situations. What to do instead: stabilize the client's condition while awaiting further orders. B. Notify the healthcare provider of the client's status. Why incorrect? The provider must be informed, but immediate interventions to stabilize blood pressure are critical. What to do instead: initiate positioning to improve perfusion and notify the provider. C. Reassess the client's vital signs in 15 minutes. Why incorrect? Delaying intervention risks worsening hypotension and hypoperfusion. What to do instead: act immediately to stabilize the client. D. Position the client flat with legs elevated. Why correct? This position improves venous return and cardiac output, temporarily stabilizing blood pressure. How it helps: provides immediate support while awaiting further treatment. Question 21, SATA. A nurse is caring for a client with a suspected gastrointestinal bleed who reports dizziness and abdominal pain. The client's vital signs show a heart rate of 112 beats per minute, blood pressure of 86/54 millimeters of mercury, and respiratory rate of 24 breaths per minute. Which nursing interventions should the nurse prioritize? Select all that apply. A. Establish and maintain IV access. B. Administer prescribed fluids. C. Insert a nasogastric (NG) tube for decompression. D. Monitor the client's hemoglobin and hematocrit levels. E. Prepare the client for endoscopy. Correct answers: A, B, D, E. Detailed rationales. A. Establish and maintain IV access. Why correct? IV access is crucial for fluid resuscitation and administration of emergency medications. How it helps: support stabilization of hemodynamic status. B. Administer prescribed fluids. Why correct? Fluid resuscitation is essential to restore circulating volume and prevent hypovolemic shock. How it helps: temporarily stabilizes blood pressure and perfusion. C. Insert a nasogastric (NG) tube for decompression. Why incorrect? NG tube insertion is contraindicated in clients with suspected active upper GI bleeding due to the risk of further trauma. What to do instead: focus on stabilization and diagnostics. D. Monitor the client's hemoglobin and hematocrit levels. Why correct? These values indicate the extent of blood loss and guide transfusion needs. How it helps: assists in assessing the severity of the bleed. E. Prepare the client for endoscopy. Why correct? Endoscopy is the diagnostic and potentially therapeutic procedure for GI bleeds. How it helps: identifies the source of bleeding and allows for intervention if necessary. Question 22, Case Study, Multiple Choice. Scenario: a client with a history of diabetes is admitted for hyperglycemia. The client's blood glucose is 420 mg per deciliter, and the healthcare provider prescribes an insulin drip. The nurse notes the client is drowsy, has dry mucous membranes, and is reporting abdominal pain. What is the nurse's priority action? A. Administer the insulin drip as prescribed. B. Start IV fluids with normal saline. C. Notify the healthcare provider of the client's symptoms. D. Monitor the client's potassium levels. Correct answer: B. Start IV fluids with normal saline. Detailed rationales. A. Administer the insulin drip as prescribed. Why incorrect? Insulin therapy is essential, but fluid resuscitation is the immediate priority in hyperglycemic crises like diabetic ketoacidosis, DKA. What to do instead: start fluids first to address dehydration and improve perfusion. B. Start IV fluids with normal saline. Why correct? Dehydration from hyperglycemia must be corrected immediately to stabilize the client. How it helps: restores circulating volume and reduces blood glucose levels indirectly. C. Notify the healthcare provider of the client's symptoms. Why incorrect? The provider should be informed, but immediate intervention is necessary before notification. What to do instead: stabilize the client's condition first. D. Monitor the client's potassium levels. Why incorrect? Potassium monitoring is critical during treatment, especially after starting insulin, but it is not the first action. What to do instead: begin fluid replacement, then monitor electrolytes. Question 23, SATA. A client is admitted with a diagnosis of sepsis. The nurse notes a fever of 39.2 degrees Celsius 102.6 degrees Fahrenheit, a heart rate of 122 beats per minute, and a blood pressure of 90/48 millimeters of mercury. Which nursing interventions should the nurse prioritize? Select all that apply. A. Administer prescribed IV antibiotics. B. Start IV fluids with a crystalloid solution. C. Obtain blood cultures before antibiotic administration. D. Apply a warm blanket to reduce shivering. E. Monitor the client's urine output hourly. Correct answers A, B, C, E. Detailed rationales. A. Administer prescribed IV antibiotics. Why correct? Antibiotics are the cornerstone of sepsis treatment and must be administered promptly. How it helps: targets the underlying infection and prevents progression of sepsis. B. Start IV fluids with a crystalloid solution. Why correct? Fluid resuscitation restores intravascular volume and improves perfusion in hypotensive clients. How it helps: stabilizes hemodynamic status and prevents organ dysfunction. C. Obtain blood cultures before antibiotic administration. Why correct? Blood cultures identify the causative organism and guide antibiotic therapy. How it helps: ensures effective and targeted treatment. D. Apply a warm blanket to reduce shivering. Why incorrect? Warm blankets provide comfort but do not address the critical priorities in sepsis management. What to do instead: focus on stabilizing the client's condition. E. Monitor the client's urine output hourly. Why correct? Urine output is a key indicator of renal perfusion and fluid status. How it helps: identifies early signs of organ dysfunction. Question 24, Case Study, Multiple Choice. Scenario: a postoperative client reports difficulty breathing and chest pain. The nurse notes oxygen saturation of 84% on room air, a heart rate of 130 beats per minute, and a respiratory rate of 30 breaths per minute. What is the nurse's priority action? A. Notify the healthcare provider immediately. B. Apply oxygen via non-rebreather mask. C. Position the client in a high Fowler's position. D. Prepare the client for a chest X-ray. Correct answer B. Apply oxygen via non-rebreather mask. Detailed rationales. A. Notify the healthcare provider immediately. Why incorrect? The provider must be informed, but immediate action is required to stabilize oxygenation. What to do instead: administer oxygen first, then notify the provider. B. Apply oxygen via non-rebreather mask. Why correct? A non-rebreather mask delivers high concentrations of oxygen, rapidly improving hypoxia. How it helps: stabilizes the client while further diagnostic tests are arranged. C. Position the client in a high Fowler's position. Why incorrect? Positioning supports breathing but does not directly address the severe hypoxia. What to do instead: combine oxygen therapy with positioning. D. Prepare the client for a chest X-ray. Why incorrect? A chest X-ray is important but not an immediate priority over addressing hypoxia. What to do instead: ensure oxygenation is stabilized first. Question 25, SATA. A client with a newly diagnosed pressure injury on the sacrum requires nursing interventions. Which actions should the nurse prioritize? Select all that apply. A. Reposition the client every 2 hours. B. Apply a moisture barrier cream to the sacral area. C. Administer prescribed antibiotics. D. Assess the wound for signs of infection. E. Teach the client and family about proper nutrition. Correct answers A, B, D, E. Detailed rationales. A. Reposition the client every 2 hours. Why correct? Frequent repositioning reduces pressure on the injury and prevents worsening. How it helps: promotes circulation and healing. B. Apply a moisture barrier cream to the sacral area. Why correct? Moisture barriers protect the skin from breakdown due to incontinence. How it helps: prevents further damage to the surrounding skin. C. Administer prescribed antibiotics. Why incorrect? Antibiotics are not typically prescribed unless the wound shows signs of infection. What to do instead: monitor for infection and use wound care products appropriately. D. Assess the wound for signs of infection. Why correct? Infection can delay healing and lead to complications. How it helps: guides timely intervention if needed. E. Teach the client and family about proper nutrition. Why correct? Adequate nutrition supports tissue repair and overall healing. How it helps, provides the building blocks necessary for recovery. Question 26, Case Study, Multiple Choice. Scenario: a client is admitted with a diagnosis of acute pancreatitis. The client reports severe epigastric pain radiating to the back, nausea, and vomiting. The healthcare provider orders the client to remain NPO and prescribes IV fluids and pain management. What is the nurse's priority intervention? A. Administer prescribed pain medication. B. Start the prescribed IV fluids. C. Place the client in a semi-Fowler's position. D. Notify the healthcare provider about the client's symptoms. Correct answer, B. Start the prescribed IV fluids. Detailed rationales. A. Administer prescribed pain medication. Why incorrect? Pain management is essential, but fluid resuscitation takes priority to address the hypovolemia often associated with pancreatitis. What to do instead: begin fluids first to stabilize the client, then address pain. B. Start the prescribed IV fluids. Why correct? IV fluids restore hydration and maintain perfusion, which is critical in acute pancreatitis. How it helps: reduces complications such as organ failure caused by hypovolemia. C. Place the client in a semi-Fowler's position. Why incorrect? Positioning helps reduce discomfort but does not directly address the immediate needs of fluid balance. What to do instead: combine positioning with other interventions after fluids are initiated. D. Notify the healthcare provider about the client's symptoms. Why incorrect? The provider is likely aware of the client's condition based on the diagnosis. Immediate intervention is more critical. What to do instead: implement orders promptly and monitor for changes. Question 27, SATA. A client is receiving oxygen therapy via nasal cannula at 4 liters per minute. Which interventions should the nurse implement to ensure safe and effective oxygen administration? Select all that apply. A. Check the skin behind the ears and around the nares for irritation. B. Encourage the client to drink at least 2 liters of fluid daily. C. Monitor the client's oxygen saturation levels regularly. D. Secure the cannula tightly to prevent movement. E. Ensure the oxygen source is free from combustible materials. Correct answers: A, B, C, E. Detailed rationales. A. Check the skin behind the ears and around the nares for irritation. Why correct? Prolonged use of nasal cannula can cause skin breakdown and irritation. How it helps: prevents pressure sores and promotes client comfort. B. Encourage the client to drink at least 2 liters of fluid daily. Why correct? Adequate hydration helps maintain mucous membrane moisture and prevents dryness. How it helps: reduces discomfort from oxygen therapy and supports respiratory health. C. Monitor the client's oxygen saturation levels regularly. Why correct? Regular monitoring ensures the client is receiving the prescribed amount of oxygen and helps detect hypoxia. How it helps: guides adjustments to oxygen therapy as needed. D. Secure the cannula tightly to prevent movement. Why incorrect? The cannula should be snug but not tight, as excessive pressure can cause discomfort or skin damage. What to do instead: adjust the cannula to fit comfortably. E. Ensure the oxygen source is free from combustible materials. Why correct? Oxygen supports combustion and poses a fire risk near flammable substances. How it helps: prevents safety hazards for the client and staff. Question 28, Case Study, Multiple Choice. Scenario: a client is postoperative following abdominal surgery and reports sudden shortness of breath and chest pain. The nurse notes a respiratory rate of 32 breaths per minute, oxygen saturation of 85% on room air, and a heart rate of 120 beats per minute. What is the nurse's immediate priority action? A. Notify the healthcare provider immediately. B. Administer oxygen via non-rebreather mask. C. Position the client in high Fowler's position. D. Prepare the client for a CT scan of the chest. Correct answer, B. Administer oxygen via non-rebreather mask. Detailed rationales. A. Notify the healthcare provider immediately. Why incorrect? While the provider must be notified, the priority is to stabilize the client's oxygen levels. What to do instead: administer oxygen first, then notify the provider. B. Administer oxygen via non-rebreather mask. Why correct? A non-rebreather mask delivers high concentrations of oxygen, which is critical in cases of suspected pulmonary embolism or hypoxia. How it helps: improves oxygenation and prevents further deterioration. C. Position the client in high Fowler's position. Why incorrect? Positioning aids breathing but does not address severe hypoxia directly. What to do instead: combine positioning with oxygen therapy. D. Prepare the client for a CT scan of the chest. Why incorrect? A CT scan may confirm the diagnosis, but does not take precedence over immediate oxygenation. What to do instead: stabilize the client first, then proceed with diagnostic tests. Question 29, SATA. A nurse is preparing to administer an intramuscular (IM) injection to a client. Which action should the nurse take to ensure proper technique? Select all that apply. A. Use a 1 to 1.5 inch needle for an adult client. B. Aspirate before injecting the medication. C. Administer the injection at a 45-degree angle. D. Select the ventrogluteal site for a large volume injection. E. Clean the injection site with an alcohol swab before administration. Correct answers: A, D, E. Detailed rationales. A. Use a 1 to 1.5 inch needle for an adult client. Why correct? The needle length ensures the medication reaches the muscle layer. How it helps: enhances the efficacy of the injection. B. Aspirate before injecting the medication. Why incorrect? Current guidelines generally advise against aspiration for most IM injections. What to do instead: follow facility policies and evidence-based practices. C. Administer the injection at a 45-degree angle. Why incorrect? IM injections should be given at a 90-degree angle to ensure proper delivery to the muscle. What to do instead: ensure a perpendicular approach to the skin. D. Select the ventrogluteal site for a large volume injection. Why correct? The ventrogluteal site is recommended for larger volumes due to its muscle mass and reduced risk of hitting major nerves or blood vessels. How it helps: ensures safe and effective administration. E. Clean the injection site with an alcohol swab before administration. Why correct? Cleaning reduces the risk of infection at the injection site. How it helps: ensure sterility and client safety. Question 30, case study, multiple choice. Scenario: a client presents with symptoms of hypoglycemia, including confusion, sweating, and tremors. The client is alert but unable to consume solid food. The blood glucose level is 50 mg per deciliter. What is the nurse's immediate action? A. Administer a glucose tablet. B. Give 15 grams of oral glucose gel. C. Notify the healthcare provider immediately. D. Recheck the blood glucose in 15 minutes. Correct answer: B. Give 15 grams of oral glucose gel. Detailed rationales. A. Administer a glucose tablet. Why incorrect? Glucose tablets are effective but may not dissolve quickly enough for immediate relief. What to do instead: use glucose gel for faster absorption. B. Give 15 grams of oral glucose gel. Why correct? Oral glucose gel is quickly absorbed and ideal for alert clients with hypoglycemia. How it helps: rapidly raises blood glucose levels to relieve symptoms. C. Notify the healthcare provider immediately. Why incorrect? Hypoglycemia requires immediate correction before notifying the provider. What to do instead: treat the condition first, then report if needed. D. Recheck the blood glucose in 15 minutes. Why incorrect? Rechecking is necessary, but should be done after administering glucose. What to do instead? Intervene to raise glucose levels, then reassess. Question 31, SATA. A client is admitted with signs of a stroke, including facial droop, slurred speech, and right-sided weakness. Which interventions should the nurse prioritize? Select all that apply. A. Perform a neurological assessment. B. Initiate aspiration precautions. C. Administer prescribed antihypertensive medication immediately. D. Obtain a non-contrast CT scan of the head. E. Maintain the client in a supine position. Correct answers: A, B, D. Detailed rationales. A. Perform a neurological assessment. Why correct? A detailed neurological assessment establishes a baseline and monitors stroke progression. How it helps, guides decision-making and interventions. B. Initiate aspiration precautions. Why correct? Stroke clients are at high risk for dysphagia and aspiration. How it helps, prevents complications such as aspiration pneumonia. C. Administer prescribed antihypertensive medication immediately. Why incorrect? Antihypertensive medication should only be administered if blood pressure levels are dangerously high, as mild hypertension may support cerebral perfusion during a stroke. What to do instead? Follow specific blood pressure parameters for stroke management. D. Obtain a non-contrast CT scan of the head. Why correct? A CT scan determines the type of stroke, ischemic or hemorrhagic, and guides treatment. How it helps, differentiates between stroke types to ensure appropriate interventions. E. Maintain the client in a supine position. Why incorrect? A supine position may increase intracranial pressure and does not optimize respiratory effort. What to do instead? Keep the head of the bed elevated to 30 degrees unless contraindicated. Question 32, Case Study, Multiple Choice. Scenario: a client is admitted for an acute asthma exacerbation. The nurse notes wheezing, accessory muscle use, and a respiratory rate of 36 breaths per minute. Oxygen saturation is 88% on room air. What is the nurse's priority intervention? A. Administer a prescribed bronchodilator via nebulizer. B. Start oxygen therapy at 4 liters per minute via nasal cannula. C. Notify the healthcare provider of the client's condition. D. Position the client in a semi-Fowler's position. Correct answer: A. Administer a prescribed bronchodilator via nebulizer. Detailed rationales. A. Administer a prescribed bronchodilator via nebulizer. Why correct? Bronchodilators relieve bronchospasm, improving airflow and oxygenation. How it helps, directly addresses the airway obstruction causing the exacerbation. B. Start oxygen therapy at 4 liters per minute via nasal cannula. Why incorrect? Oxygen therapy is important but secondary to resolving the bronchospasm. What to do instead? Administer oxygen after initiating bronchodilator treatment. C. Notify the healthcare provider of the client's condition. Why incorrect? Stabilizing the client is the priority before contacting the provider. What to do instead? Treat the acute symptoms first, then notify the provider. D. Position the client in a semi-Fowler's position. Why incorrect? Positioning supports breathing but does not resolve bronchospasm. What to do instead? Use positioning alongside bronchodilator therapy. Question 33, SATA. A client has a stage 2 pressure injury on the sacrum. Which nursing interventions are appropriate for wound care? Select all that apply. A. Clean the wound with normal saline. B. Apply a hydrocolloid dressing. C. Massage the area around the wound to improve circulation. D. Assess the wound for signs of infection daily. E. Ensure adequate protein intake. Correct answers: A, B, D, E. Detailed rationales. A. Clean the wound with normal saline. Why correct? Normal saline is a non-irritating solution that promotes wound healing. How it helps: reduces the risk of infection and prepares the wound for dressing. B. Apply a hydrocolloid dressing. Why correct? Hydrocolloid dressings maintain a moist environment conducive to wound healing. How it helps: facilitates granulation tissue formation. C. Massage the area around the wound to improve circulation. Why incorrect? Massaging near the wound can cause further tissue damage. What to do instead: use pressure relief techniques to improve circulation safely. D. Assess the wound for signs of infection daily. Why correct? Regular monitoring ensures early detection of complications. How it helps: promotes timely intervention if infection occurs. E. Ensure adequate protein intake. Why correct? Protein supports tissue repair and wound healing. How it helps: improves the body's ability to heal effectively. Question 34, Case Study, Multiple Choice. Scenario: a client with heart failure reports worsening dyspnea and has gained 4 pounds in 3 days. The nurse notes bilateral crackles in the lungs and pitting edema in the lower extremities. What is the nurse's priority action? A. Administer prescribed diuretics. B. Notify the healthcare provider immediately. C. Assess the client's potassium level. D. Restrict the client's fluid intake. Correct answer: A. Administer prescribed diuretics. Detailed rationales. A. Administer prescribed diuretics. Why correct? Diuretics reduce fluid overload, alleviating dyspnea and edema. How it helps: directly addresses the client's symptoms and prevents further complications. B. Notify the healthcare provider immediately. Why incorrect? While communication is essential, immediate action to relieve symptoms takes precedence. What to do instead: treat the client first, then inform the provider of the response. C. Assess the client's potassium level. Why incorrect? Potassium monitoring is important but not the immediate priority. What to do instead: monitor potassium after administering diuretics. D. Restrict the client's fluid intake. Why incorrect? Fluid restriction supports long-term management but does not address acute symptoms. What to do instead: use diuretics to manage the current fluid overload. Question 35, SATA. A nurse is caring for a client with newly diagnosed diabetes. Which education points should the nurse include in the teaching plan? Select all that apply. A. Rotate injection sites for insulin administration. B. Monitor blood glucose levels before meals and at bedtime. C. Limit carbohydrate intake to less than 50 grams per day. D. Recognize signs and symptoms of hypoglycemia. E. Schedule regular follow-up appointments with a healthcare provider. Correct answers: A, B, D, E. Detailed rationales. A. Rotate injection sites for insulin administration. Why correct? Rotating sites prevents lipodystrophy and ensures consistent insulin absorption. How it helps: promotes effective glycemic control. B. Monitor blood glucose levels before meals and at bedtime. Why correct? Regular monitoring helps clients maintain target glucose levels. How it helps: identifies trends and prevents complications like hypo or hyperglycemia. C. Limit carbohydrate intake to less than 50 grams per day. Why incorrect? Carbohydrate intake should be balanced, not excessively restricted, to meet energy needs. What to do instead: educate clients about carbohydrate counting and portion control. D. Recognize signs and symptoms of hypoglycemia. Why correct? Early recognition allows clients to take immediate corrective actions. How it helps: prevents severe hypoglycemia and associated risks. E. Schedule regular follow-up appointments with a healthcare provider. Why correct? Regular follow-ups ensure ongoing evaluation and adjustment of the treatment plan. How it helps, supports long-term diabetes management.